I would say that the opioid epidemic is maybe one of the most tragic public health crises in United States history. Why? It is corruption. Millions of workers were going to their jobs and going about their life with unbearable amounts of pain. And so a lot of immigrant families will just be more comfortable experiencing pain.
Executives knew maybe as far back as 2007.
This is something that took the life of almost 1 million people, and the people directly responsible for this, no one has gone to prison.
For those of us who aren't aware, what was or is the opioid epidemic that faces North America, but other regions across the world as well?
So I would say that the opioid epidemic is maybe one of the most tragic public health crises in United States history. And it's something that started from the introduction of a new drug called OxyContin by Purdue Pharma that completely changed the landscape of pain management in the United States. And basically what that did was to deceive physicians and patients about the risks of prescribing very addictive opioids for conditions that were chronic and for moderate pain. And so basically, patients were being sent home with a prescription that was going to make them addicted to opioids. And then that led to then broad addiction in communities that created later on the development of heroin markets. And with the introduction of fentanyl, that is extremely dangerous and very easy to smuggle, also the spread of fentanyl overdoses and almost 1 million lives lost because of this.
Yeah. So, yeah, because this isn't something I think, I mean, we probably do have some of it in the UK, but we don't necessarily see as much of this in the UK. But when I've spoken to some of my friends or just sort of colleagues and stuff in the States, this is a very big sort of political issue. Obviously, it's maybe something that we're not quite aware of. But these opioids, various forms, are essentially like legal forms of heroin and sort of in many instances in terms of just how the strength of them.
Chemically, they're not that different to heroin. So withdrawal and dependence, all of this can happen within weeks and at prescribed rates. So you don't need to be misusing your prescription in order to develop an addiction. And we know that addiction to opioids or heroin specifically is the strongest physical addiction someone can experience.
Right. And so they're really they're incredibly lined up then when you see sort of withdrawal symptoms, stuff from heroin and those like OxyContin, obviously in this instance from Purdue, they line up pretty much perfectly. And that's because they're essentially chemically almost the same thing.
Exactly.
It kind of begs the question then, and again, this just comes from someone that's kind of very ignorant to some of this stuff just because of the sort of where they live. It makes me wonder how exactly these drugs, or drug in particular, was able to get legalized and used so pervasively across the States. Because even taking out the fact that, people do need pain meds, obviously, and these are certain things, you would possibly thought that for that level of strength that they're after, it would be very severe instances. Morphine, for example, was only ever used for like wartime things and very sort of severe surgeries and stuff, right? And so the idea that it could spread and have this sort of idea of an epidemic, I don't know whether, it's not a communicable disease. But from some of the research I've done, there was a federal judge several years ago who presided over a lot of these cases, basically described it as, it is accurate to describe the opioid epidemic as a man-made plague 20 years in the making, right? So I get, there's kind of two factors that, again, sort of coming off of that is, one, why was it allowed to spread so far? And two, why did it affect so many people? Because again, you would have thought that even if it did somehow get through the FDA regulations and stuff for use as a pain med, that not that many people should have have access given to its strength.
So I think why it is corruption. And so we have to think about the millions and millions of dollars that were thrown at agencies at different levels of government. One is to just look the other way, but then also these lobbying campaigns, where the idea was that in the United States, what was happening is that we had an epidemic of untreated pain, and that millions of workers were going to their jobs and going about their lives with unbearable amounts of pain, and we needed to treat that. And so they were telling the story about how pain should be the fifth vital sign, and that it should be treated in and of itself rather than as like the symptom of something else. So there was just like this whole campaign about how the big enemy of American families was pain, and that physicians were responsible to treat that pain. And going back to our previous point about like how did we get to a point where we were like used to or we were comfortable prescribing opioids, we have gone back and forth with the use of opium in history. And so when after the Second World War, it was actually common to treat patients with morphine and heroin because it's such an effective drug to treat pain.
Yeah,
but
right.
then, of course, people develop addiction and dependence. And then after that experience, it was regulations around it change. But then we forget about these things. And there was this letter to a journal. So this was not a referee or an academic article. It was just a letter to the editor of the New England Journal of Medicine, which is a very important medical journal, which basically was just like sharing anecdotal evidence about the use of opioids in some inpatient setting. And the conclusion was that only 1% of patients in that very controlled setting and also very small and selected sample developed addiction. And so pharmaceutical companies use that quote as evidence that this new generation of opioids were not as addicted as we had thought before. And this was just something that was repeated endlessly, and it was sold as scientific evidence. So it was sold as like, oh, this reference from the New England Journal of Medicine says that like this is actually the risks that we're facing, but that is completely untrue. And now we know that they were like the use of that quote was completely misleading. But then this only happened, I think, in the United States because of the amount of money that there is around marketing of drugs, which I think is very different in other countries. That pharmaceutical companies cannot just spend millions of dollars in gifts and travel and dinners
or just marketing.
To physicians.
Or just in most countries don't allow it. I think. I can't remember, this was a little bit of an old statistic, but I'm pretty sure like in terms of open marketing of drugs and stuff, it was just like New Zealand and America for like a very long time that were allowed to sort of actively promote stuff on like TV. And I'm sure there was some promotions and stuff, but in terms of large scale and stuff. So despite some of the...
we're also talking about like physicians receiving money from pharmaceutical companies.
Which is just something that I find very hard to understand. I mean, that's almost like a separate thing in terms of like the healthcare industry in America. But I think from my end, it is very hard as like an outsider to understand just from, I'm an auditor. One of the things I look for when I'm auditing things is things like conflicts of interest, code of conduct, and this financial incentives. And just this idea that doctors can essentially receive incredibly high pay packets for promoting a specific drug. It's basically, it isn't congruent with that kind of line of thinking. And it's very hard for me to understand. I mean, I see this every time I go to the States for work or whatever, the amount of like adverts and stuff I see on TV and stuff is just like a very foreign concept to me. But it sounds as though it's that marketing aspect, at least in the States, that has allowed it to exacerbated it to the point where it's like considered an epidemic by a lot of people. Whereas in other countries, they may have had like localized incidents because of various corruptions and bits and pieces and legalization of the drug itself. but the absolute spread of it across North America is partly to do with this sort of marketing campaign.
Yes, absolutely. And on both sides. On one, just like the economic incentive to physicians, but then also of like this narrative that we should completely take away pain, and that is an objective. And there is interesting work about how in the United States, families from different backgrounds, there's like a different tolerance to pain, and so a lot of immigrant families will just be more comfortable experiencing pain, whereas like in America, it has been normalized that there is no discomfort that is acceptable to live with.
That's interesting. I'd like to see some research on that, actually. Potentially, if you take like Eastern European countries, where particularly through things like all the Orthodox Christianity, potentially where there's almost like a religiousness to like suffering to some degree, right? And so there's probably a little bit more acceptance to it. And then when you compare that to kind of the customer service culture of America, where if for the right price and stuff, you can sort of mitigate a lot of things. I'd be interested to see what kind of relationships there are on there from different, because that doesn't sound necessarily like an ethnic thing to me. It sounds just more like a cultural aspect almost of like societies and stuff. So that might also get to your point. That's probably a big factor in why North America in particular was so effective.
And I guess also the fact that there is no national health insurance that is negotiating prices and drugs also makes all of these incentives more.
Yeah, I was just saying, it's interesting because I think, and I could be completely wrong on this, so you can completely shoot me down, but obviously America does have Medicare and Medicaid. But I think I read something like not too long ago that Medicaid, Medicaid, they were specific outlawed that they couldn't negotiate bulk pricing for like certain drugs and stuff. Whereas obviously comparison to like the UK, for example, the NHS, part of the benefit of having a national health service is that, instead of individuals going to buy specific drugs and prescriptions, you as a country can be like, right, okay, what is going to be our drug of choice that we're going to use for, I don't know, severe allergies or for something. And there'll be several options, and you can basically bulk negotiate certain things to get prices down, right? And there's other reasons why some of those prescription prices are much lower than in some other countries. It's, again, to your point about sort of corruption and the sort of the political relationships in regards to this epidemic, there does seem to be a lot of political factors and legislative factors that seems almost to have failed that have allowed this to permeate.
Yes. But then parallel to all of this, when you like read about the opioid epidemic and even just like see the documentaries on Netflix, HBO, what has been written in like popular culture, you can see that there were so many warning signs from physicians, from officers in the DEA, in the FDA, in the police, attorney general offices. And this could have been stopped. It would have been already a tragedy in 1999, and it could have been stopped there. In 2002, the things that there were already class actions in 2002, and it could have stopped there. In 2006, there was also something, a very large investigation, and it could have stopped there, but it didn't. So there were just like so many warning signs that were ignored, and I think part of that again is going to be corruption. But I think another part is the fact that it wasn't understood as an epidemic, as more of like individual, like personal responsibility.
Right.
So when you see just like the widespread of addiction, and this is just like, this is someone that doesn't have their life together and is finding the solution or the answer in drugs, and it's just like a very complex social problem that this person is part of. I think it's easier to not think that there is like a clear governmental responsibility in understanding the story of like how that person ended up in that situation, when this was not something that was happening in previous periods or not across the US in the same rate, that it was really the result of your physician telling you to go home with this pain medication for your back that then derailed your life. But I think it's very easy to just think of drug addiction as an issue of personal responsibility and not. And then once there is broad spread addiction, to turn it back is extremely costly. And I think that's also like where we are today in how like all of the policy responses are totally insufficient. Because I mean, to have someone recovered from an opiate addiction, you need to go to rehab for months, and this is extremely costly. And at that point, the amount of resources that need to be spent to like bring this population back is extremely high. But so I think that's another important point, that it was not seen as like a public issue, but like just like a matter of personal responsibility. And then people were left off to their own devices.
Right. And I think this kind of skips forward a little bit, actually, sort of straight into kind of the research that you were doing. But there was this court case, or several court cases even, in regards to Purdue Pharma, obviously the makers of Oxycontin. And some of the research that I was doing in some of these under recently disclosed or relatively recently disclosed files from the court hearings kind of outlined that actually Purdue Pharma executives knew maybe as far back as 2007 that actually there was very high addictive rates, and they were putting in mitigation strategies to try, to avoid like certain things. And there's even potential evidence from those released files that after declaring bankruptcy, after one of their settlement agreements, they'd essentially moved billions overseas to kind of avoid sort of some of these sort of negative fallout of this thing. And so to your point about sort of corruption and sort of the political influence, it's very hard when I hear those things, and obviously we can talk about it a little bit more and about the research and what you were kind of doing in the areas and the data that you were looking at. It's very hard for me to not kind of draw a link there and think that, well, this clearly was understood, and that ultimately that safeguards just weren't put in place and financial incentives took people to do things they really shouldn't have done.
Yeah, I mean, this is something that took the life of almost 1 million people, and the people directly responsible for this, no one has gone to prison. And as you're saying, most of their money is still protected. So this is like a tragedy from all sides from all angles.
Sure. And talk to me a little about your research in particular. What were you looking at sort of going into this, and what were your objectives of the research that you were looking at?
So, I mean, this all started from like a completely different research question. So I was interested in child maltreatment and child neglect, like broadly speaking. And when I was talking to people about this, everyone said like, well, if that's your research interest, you should study the opioid epidemic. Because in like contemporaneous North America, the story today about child neglect and child maltreatment is the story of the opioid epidemic, and how we have a generation of young parents that are battling addiction, and there's children growing up witnessing this, and this creates all sorts of challenges. So at that point, and this is already like 6 years ago, I was thinking that there was already a lot of work in the opioid epidemic. And I was like, well, I mean, do I really want to write another paper about the opioid epidemic? But my research interest was like this story about like what are the long-term consequences of child maltreatment and neglect, and how do we study that? And so I was like, okay, I mean, that specific paper hasn't been written. So let's try to think about the opioid epidemic as the setting to study that question. And then once I made that decision, it's like, okay, what type of variation? So in economics, we're always trying to exploit exogenous variation to exposure to a crisis. And so, okay, like where is the literature on like what type of variation we could exploit to get at the effect of exogenous exposure to the opioid epidemic and see the effects on child maltreatment and neglect. And it turns out that there wasn't any reform or any like regulation change that we could exploit to get at this question. And so it's like, okay, let's go back before just like thinking of child maltreatment and neglect as our objective. Let's just like try to figure out a source of exogenous exposure to the opioid epidemic. And so what we did was we went back to the court documents that were at the time were recently unsealed. So as you know, that there are thousands of like counties, cities, states that had sued Purdue Pharma and other companies for their responsibility in the creation of the opioid epidemic. And because of that, there was a lot of internal documents from Purdue Pharma and other pharmaceutical companies that were subpoenaed. And most of those records were made public. So I called the courthouse and I asked for copies of those records. And they said, sure, you just need to pay for like the copies, the actual physical copies. And I was sure I can do that. And they literally sent to my house like 11 boxes of documents, like not numbered, not just like boxes of paper with no index, no nothing. And I didn't even know what I was looking for. I mean, I wanted to find a map or that was like, okay, we're going to target these places because XYZ, or like a list of sales representatives that was like, oh, these are the best sales representatives from Purdue Pharma, and this is where we send them. And then like maybe the opioid epidemic propagates from those places.
You'd almost hope that they had, well, you'd hope they have like, I don't know, in the modern day electronic documents for all this kind of stuff. But it sounds as though even we still, I mean, separate issue, but it sounds as though you should really have.
So this goes back to the mid-90s. And then even if there were some electronic documents, I think like courts are still like very old fashioned. So when you see on TV, like lawyers coming in with like boxes, they're just like literally carrying like when there's discovery and all of these things. I mean, maybe in 2026, not the case, but I think until very recently, a lot of these was like there were like physical copies of
I always thought on TV that was just like a visual illustration. I honestly just generally thought like in my mind that this must be all electronic now. This is ridiculous.
Well, maybe now, yes. But
I hope so, but at least not back at this point. Yeah.
Not. I would say not like 3 years ago, and not 5 years ago, and definitely not before. And so I'm just like opening these boxes and just like going through documents. And I mean, I've been working on the opioid epidemic already for like 6 years. And the thing that like keeps me interested is that it's just so infuriating and it's so crazy and it's so tragic that it's you don't get bored. So, I mean, reading all of these documents was just, it was like creating something in me that's like, yeah, I'm going to go through like all of these documents. This is tragic. It's horrible. I was taking screenshots all the time and like sharing to friends, like, can you believe these people? It was crazy. But so then I didn't find the map. I didn't find the list of like the top representative. But what I found were references to how OxyContin, the development of OxyContin was because there was a previous drug called MS-Contin. And that drug was the gold standard to treat cancer pain. And Purdue Pharma, they were the producer of this drug, and they completely owned the market of cancer pain. But that drug was going to face generic competition. And so they wanted to develop a new drug that would take over that market that they already had. But they had this idea of then expanding to the larger non-cancer pain and non-terminal pain. But because at the time, opiates were not used for those conditions, they were like, okay, we need to start from the physicians that currently are comfortable prescribing opioids. And those are the physicians that treat cancer patients. And now we're going to tell them that this is the new drug for what they were already doing. But then this drug also has these alternative uses. And so the idea is that those same physicians, and all of this is like explicitly said in their documents, they said that the idea is that those same physicians now start prescribing OxyContin to their non-cancer patients.
So they're specifically targeting them because that they know they're more likely to prescribe that, and they're more comfortable with prescribing higher dose painkillers already.
Exactly. So this was a story about a spillover from cancer patients to non-cancer patients through their shared physician.
Right.
And so I tell my co-authors, like, the thing that I keep on reading over and over again is that they're targeting the cancer pain market. And she comes back to me with a graph where she splits like the top quartile of cancer incidence, counties or commuting zones in the US, and the bottom quartile of cancer incidence. And the spread of the distribution of opioids is super clear. That before the launch of OxyContin, like there is a little bit of a gap, but not so much in terms of like high versus low cancer places. But then there's just like these places completely drift apart. And so high cancer places start to just receive a massive influx of opioids. That is not, and it's not just because, these are like high cancer places are places where you need like cancer drugs, and those are opioids. Like these cancer patients were already being prescribed opioids. So all of this extra shipment of opioids that we see are going to the non-cancer patients. And we also show that it's not like high cancer areas are high growth cancer areas. This is actually something that is pretty stable. So it's most that what we see, the drift apart, like the excess of opioids that we see in the high cancer places are just non-cancer patients to whom opioids are being prescribed. And yes, you have some questions.
Yeah, but essentially, I'm just curious because now, obviously, I think this is kind of like an interesting point to sort of make in the middle of this. I don't think what we're saying here is that there aren't instances in which very high dose painkillers shouldn't be used. I think we talked about this earlier with like morphine use within the world wars. You know, just outside of the severe pain aspect of it, if you're in severe pain and stuff, but, you know, to stop someone from going into shock, for example, which will absolutely kill you, all these kind of, there is a certain use for it. And I can even imagine in many instances for certain cancers and stuff, that the level of pain is obviously excruciating, and to the point where obviously there's a reason why these doctors who were targeted are a little bit more used to doling out these kind of painkillers because they are used in inappropriate stuff in some instances. I think, but the problem is using them. I mean, it's trade-offs, right? You know, at that point, you're really choosing between, you know, shock, extreme pain, and then the addictive element of just how addictive these components are. And you're making that decision, but right, this option is actually better than this. They're both bad options, but this option is better than this option. Where the issue comes in is when it starts spilling out for using these opioids for things that are outside of severe pain. There's just no way that the pros outweigh the cons. And so actually what you're doing, instead of giving someone a medicine or a prescription where it's going to make, you know, it'll make some things better, but some things worse, it's just going to make things worse for most people.
Exactly. And to the point that, I mean, we mentioned a little bit of this before, but I mean, in the US, it's still common to receive an opioid prescription from just going to the dentist or for chronic back pain. So this was just like taken to the extreme. And there is work that shows that the quality of your medical school is going to predict how much opioids you prescribe. So there are some determinants of like what makes a physician more likely to prescribe opioids, and like the quality of the physician is. Sorry?
It was interesting. So the quality of the medical school you went to, I guess, by ranking something, there is at least some correlation between that and the level of which you'll prescribe opioids.
Yes. So doctors from better med schools prescribe lower rate. Their prescription rates of opioids are lower.
Wow, interesting. And obviously, the correlation doesn't mean causality, but that is an interesting correlation there. Like if you're going to, you know, maybe these doctors that are from better medical schools, I guess you would assume better trained, and so they just understand the consequences of these drugs a little bit more, and they're a little bit more knowledgeable about it.
I think that's like the story that that paper is trying to tell, and maybe there's also a little bit more of so like these physicians are also all the time receiving trainings about new drugs, and maybe the understanding of the conflict of interests in when Purdue Pharma comes and invites me to a conference in Hawaii about like their new drug developments, and like how should I really receive all of that information with a grain of salt, like that component of like continuous training may also play a role in terms of like the quality of physicians. And now I don't know where we were talking.
Oh yeah, no, my apologies. I completely cut you off. No, I think we were getting into some of the, essentially, there was evidence essentially from these unreleased files that doctors that were treating cancer pain essentially were being targeted specifically, which again is a little bit more normal. But then, as it went on and as the marketing increased, it started to spill over into the more general public.
Okay, yes. And now I remember. So you were telling me, how did I start thinking about all of this? And the answer was like, I was interested about this other thing, which was child neglect and child maltreatment. But then in trying to answer that question, we were like, okay, we first need a measure of exposure that is somewhat exogenous, that is driven by the decision of Purdue Pharma and not by the local decline of a community that then may seek pain medication. And so when we saw this story about like how it was really the influx of pills was a function of the size of the cancer pain in the past, we're like, well, we have this exposure that is really supply driven. And so we're like, well, maybe we should just first tell the story of like what are the broader economic consequences of the opioid epidemic, rather than like the maybe like smaller, or like maybe not necessarily smaller, but like very specific question of like child neglect and child maltreatment. So like we should tell first the story of like how this really changed the economies of those places. And so that's what we did first. And we saw that these places were becoming poorer. So there was greater dependence on welfare. The people in these communities were also more dependent on disability. And so when we were presenting this work and talking about like the economic hardship that was induced by the opioid epidemic, a common question that we were asked was like, well, and what do you think are the political effects of this shock? And we were like, well, I have no idea. Your guess is the same as good as mine. And so we wrote that paper and like, well, maybe now that like that paper is written, we should like the natural next step, because it was the natural like follow-up question that everyone would have, was like, are there any political consequences of this? And it was like, it's natural to think because there was just like such a large economic effect, but there is no intuition of like which way it should go. And so when we looked at the data, it was very clear that basically the same separation that we saw in terms of like places that looked very similar before the onset of the opioid epidemic, and then higher cancer places that were just that received massive influx of opioids, those places were turning towards the Republican Party at a much higher rate. And so we wrote that separate paper, and when we did that, like there was like a little, it took us some time to be able to explain how come is it that then the Republican Party is benefiting from the opioid epidemic. So ultimately we ended up like, right, we have two papers that then became one, and it became one because we think that there are three important things that determine the effects, the favorable result for the Republican Party. But the main thing is going to be that it created economic hardship of white working class Americans. And during this period, the Republican Party was really campaigning on the economic hardship of white working class Americans.
Yep,
and
sure.
This is like in the broader, like there are other things that are happening that made this the case. And for example, everything related to trade and how openness to trade led to the decline in manufacturing employment and slower growth in wages and so on. even though this is something that was something that the Republican Party was campaigning for many years and led to the approval of NAFTA and all sorts of trade agreements. It was the Republican Party, the one that started to see the hardship that some white working class Americans were enduring, and that a lot of this hardship was not like the result of like their own decisions and their own failures, but that it was something that was just like there is a change in the economy and the environment in which like firms hire and the types of jobs that are available. And so they saw that gap in this is a story that is not being told, is not being acknowledged. And the fact that the opioid epidemic just like created more of that same story made then the increase in hardship for this specific group of people something that was favorable for the Republican Party. So then that's why like both putting like the two papers together made sense, and how like first telling the story of like how this really changed communities in a way that was very detrimental for their subsistence, and is specifically white working class Americans that were most affected by that. And then during this period that this is starting in like the mid 2000s and late to 2010s, this is the slogan in a way of the Republican Party. So their experiences are being acknowledged in a way that the Democratic Party was not doing so, and maybe was just speaking about or recognizing the hardships of other groups, of marginalized groups, of racialized groups. That, I mean, it's also valid, but they was just like not seeing that the hardship of this specific group. So that's one reason I think all of this was favorable for the Republican Party, but we also document two other things. And the second is, which is also very interesting, is that we look at the coverage of local newspapers by their political leaning, so liberal versus conservative leaning newspapers. And what we find is that conservative leaning newspapers were talking about the opioid epidemic at a much higher rate than liberal leaning newspapers. And when they were reporting on this was a function of what was happening in their local communities. So they were like, again, like they were more in touch with what was happening in their local communities, and specifically in the experiences of the opioid epidemic. And then on top of that, they were also framing the opioid epidemic around issues that were favorable for the Republican Party. So then also bringing a little bit of a discussion on illegal drug cartels and the fact that many of these are going to be from immigrant countries, and the Mexican cartel of heroin, or Colombian drug cartels. So also like bringing a little bit of other topics that are in general favorable for the Republican Party.
Yeah, or drugs being smuggled across the border in Canada as well, and all that stuff.
Exactly. And then the last thing that I think also made this favorable for the Republican Party is that a lot of the harm reduction policies that have been put forward to deal with the opioid epidemic, and which are more like liberal leaning or that have been pushed by the Democratic Party, those haven't been successful. So, for example, in Oregon, there was the decriminalization of drugs, and that was a huge disaster. And they actually went back on those policies because it increased the number of overdose deaths. Another example is syringe exchange programs that have also increased overdose deaths. And then we show that there is a distaste for these harm reduction policies, to the point that places that have higher rates of exposure to the opioid epidemic see lower lower support for marijuana legalization ballots in the U.S. And so there is it's like a rejection to these like harm reduction policies that are more liberal leaning, and what people want is just law and order. Which is not to say that there is any success about law and order and like increase the number of police officers in dealing with the opioid epidemic. But there is an alignment with the policy response that the Republican Party is putting forward, and a distaste for the policy responses that the Democratic Party has put forward. So we think that it's like those three things. So that it created economic hardship for white working class Americans, and that was something that the Republican Party was actively campaigning on, even if not talking about the opioid epidemic. But they were talking about how the forgotten America and the America left behind and the opioid epidemic fueled that. So that's one thing.
And I suppose and to your point, interlinkages with some of their other policies, border policy, particularly with regions that have sort of illicit drug activity and all this kind of stuff, probably elicits more of this kind of linkages as well. You mentioned there actually just in regards to some of these policies in Oregon, in regards to decriminalization and sort of like safe needle usage and stuff. Obviously, those are policies that have been trialed in Europe, whether in sort of the northern regions or even in Spain, actually, I think, in terms of decriminalization and safe needle programs, for example. I haven't read up on them in a while. I mean, it's been quite a while since I've looked into it. But my understanding is, particularly in those areas, there seems to be some evidence that those schemes do work. And my presumption is that the reason why Oregon and these other states implemented them is because they thought it was going to work. Is it possible the opioid epidemic specifically, in alignment with these policies, it meant that they were going to fail potentially, as opposed to maybe in European countries or in other places where these kind of strategies were implemented, where opioid use is maybe less common or at least widely available from sort of these sort of industrial pharma companies potentially?
So there is one very successful implementation of this type of programs in Portugal. But it was like very specific, like in one city, contained, very well funded. And this was already like many years back. So I think the context is much easier to deal with this in a small city than like across the country or in a large state. And then it's also a function of like how much money are we putting in into these type of programs. It's not to say that there is like no way in which harm reduction policies can work, but a lot of like how can it work or not is in the details. And then another thing is that all of this was happening at a moment in which the landscape of drug use was changing rapidly. And so in 2016, where like the I forget the word is the fentanyl, how to create fentanyl in like a very like easy way at like a simple lab at home. This is going to completely change the drug market. It's going to this is a drug that is extremely dangerous because of how potent it is. It's a drug that has no odor, that because of how potent it is, like a gram can serve for like dozens, hundreds of doses. So it's just like so easily smuggled. And then it was just laced with all sorts of other drugs. So you're doing these harm reduction policies, and in a way, this is decreasing the risks of using drugs at a moment in which the drug market itself is changing rapidly in a way that is more and more dangerous. And of course, like now we're learning about like how more dangerous it is now. But when it's happening in real time, it's hard to know for dealers, users, enforcement, or like what are we dealing with? So maybe it's like a combination of like everything that could go wrong went wrong. And these things were put in place at a moment in which like drugs were extremely dangerous to use, and where there is really no way to control the distribution of fentanyl, the quality of the drugs that are being sold and consumed. So maybe in a setting, and then again, if we go back to the examples where this has been successful, none of these ingredients were happening. Like the population that was addicted to heroin in Lisbon was like a very specific small population that it was contained. And then for that, there was not a problem about like new people like starting to use heroin and like that market growing and developing. Right. It was more about like, okay, we have.
This is the problem, isn't it? When you try and extrapolate research, in particular, that has a small case study size in a particular region on particular adults or people across like essentially useful global policies, essentially, because you miss so much more of this sort of nuance and context around certain of these things. And I think, unfortunately, to go back to the sort of political angle of your research, the policies in regards to sort of safe needle use or sort of legalization of drugs, freer borders, is obviously policies that are associated with the Democratic Party. And so when you have the effects of these epidemics and these drug policies that were implemented, particularly in sort of blue states, that's obviously naturally going to incline people, obviously, probably to vote more Republican, who obviously stand opposed to a lot of those policies.
Exactly.
Yeah, it's a fascinating situation. I think that there's probably like a wider point we could probably make on this. I mean, you even mentioned it earlier about the reason why some of they didn't realize these specific oxycontins and opioids were quite as addictive, because there was essentially just one study that was used quite anecdotal cases, and that was then used and extrapolated on marketing campaigns by doctors and scientists who, quite frankly, should probably know a bit better, because they studied this for extended periods in school about case sizes and data sampling and stuff. But it has wider impacts, and so I think probably we have to be very careful about the research we use and comparing it to and implementing it and elsewhere. I think an interesting question would be to ask you: would you expect similar enduring political effects from other types of health shocks? Because this is obviously a very specific type in regards to some of the prescription drugs, essentially, and drug usage. But if there were other types of health shocks, would you potentially see similar enduring political effects? Or do you think it's a very unique case study in that regard?
I think, first, I think economists, we're very bad at predicting things. and so I would be very cautious, and I think there are many circumstantial things that made this specific crisis favorable for the Republican Party. So I don't think there are obvious reasons to think it would go one way or another. I mean, even with the COVID pandemic, it was politicized in a way that I think ex ante would have been hard to predict. But the specific ingredients that made the opioid epidemic something that is favorable for the Republican Party. So, for example, like the main thing is like economic hardship of working class Americans. Like this has been something that has been the slogan of the Democratic Party for most of its history. So it is really like this happening in like this specific moment in history that was favorable for the Republican Party. So even like that specific contributor is very time dependent that made it profitable for the Republican Party.
With the border policies and smuggling across from Mexico, all these kind of political zeitgeist things just happened to coalesce at the same time, and that's probably what sort of contributed to it. If it happened at a different time, in a different era with different, things going on in the zeitgeist and culture, it probably would have had maybe a different impact.
Exactly. And I mean, the other thing is like, why did Republican-leaning media talked about this more? Why was Fox News talking about the opioid epidemic more than CNN or MSNBC? And you can maybe think that conservative leaning media is more worried about, or like there is a greater demand for things that are about like panic and fear. And so maybe like that is something that could be repeated.
Yeah, I mean, we were speculating, obviously, but I think, if I was to postulate something, I would say it's kind of that thing I mentioned earlier. typically more conservative leaning people are more skeptical about legalization of drug policy, whether that's marijuana or just any other types of drugs or sort of uses for recreation. Whereas more left-leaning liberal individuals tend to be a little bit more free policy on that. And kind of, I think, as I mentioned earlier, those policies that were implemented in Europe in very specific instances in regards to legalization in terms of how it affects overdose cases and safe needle policies fit more in terms of that political agenda, and I think probably, and again this is speculation, but probably fit more in terms of the democratic angle. I mean, when you talk about Oregon, you talk about California, when some of these things are very pertinent, these are very left-leaning states, right? And so if I was postulating, I would say that's probably why. They probably don't talk about it as much, is because it probably goes against some of their standardized beliefs in terms of some of the sort of drug use policy, whereas compared to sort of more right-leaning conservative political parties, it comes up as like a more natural opposition. But again, I mean, who knows, right? It's such a constellation of factors. You could bring populism into it, the growth of social media and sort of off-brand, political sources and things like that. You could bring in a lot of things that sort of contribute in that regard.
So, and one thing that we haven't mentioned is that when we first saw this result, that this was clearly favoring the Republican Party, a natural question is well, are politicians campaigning on this? And the answer was no. I mean, until 2016, so this is 20 years after communities enduring harsh effects of the opioid epidemic and widespread overdose deaths, this was not a topic of national discussion. So it's also interesting to see how people from neither of the parties were talking about it and campaigning on these issues. And this is something that again could have a completely different story in a different type of health crisis or health shock. So all of this is happening really indirectly from direct. So we looked at Twitter engagement about the opioid epidemic, and we see no difference between Republicans and Democrats. We also looked at speeches in the House and Senate, whether Republicans or Democrats were talking about it more. It was really not discussed in the House or in the Congress floor. And it was only until 2020 that the opioid epidemic was a topic in their campaign slogans for Congress. So it took many years for this to be a topic that politicians were campaigning on and engaging with. So
yeah, and I guess having my sort of perceptions of how politicians act in many regards, I think if conservatives and Republicans in the States had realized and had known about this kind of causal relationship, I think they probably would have been talking about it a lot more and perpetuating it. But it just seems as though it's completely, they're doing so. This support for the Republican Party from this epidemic and crisis almost went sort of unbeknownst to sort of both parties. Because again, to that point about it being relatively equal split in terms of engagement online and in political discourse, I'm sure if the Republican Party had known, they would have been, hammering down on it to make sure they got the election result in. And to your point, actually, even when it sounds as though it starts getting brought up in sort of some of the discourse in 2020, even then it's kind of overshadowed by the pandemic situation of COVID-19. So an epidemic is kind of almost being put to the back burner, I would imagine, from a global pandemic issue potentially as well. So even when it does come to the forefront, it's not even at the forefront for an extended period of time as well.
Yeah. So, I mean, just to conclude this point, I think that there's just many circumstantial things that made this be favorable for one party, and all of those things I think are very hard to predict. Where would they side on if we were to experience a similar or different health crisis? Yeah. But I think it's interesting to to see how like things that are completely separate, very far from having like a natural connection, can have some massive effects, which is what we documented in that paper.
Yeah, right. And obviously, a lot of these case law and sort of cases were raised in sort of 2010s, and you talk about some of the issues raising to, at least in terms of not parliament, in terms of politics and sort of the early 2020s. How does the landscape look today? I mean, have the effects of the opioid epidemic been fully realized, or are we likely to see a continued impact to American politics in the future as well?
So, I mean, the good news is that that's stopped rising already for like a couple of years. So at least, I mean, there's still thousands of people dying every year from overdose deaths from opioids, but at least it's not continuously to grow exponentially. For so many years, it was a record-breaking number of deaths. So that's a good news. But then in follow-up work, we're now looking at how the opioid epidemic changed all margins of demographic adjustments. So we see that places more affected by the epidemic grew at a slower rate. And most of this is because it increased out-migration from these places. And we actually see that declining growth is a little bit compensated by some increases in fertility. So even as like maybe the political effects are specific to like the story that we're telling was specific to the political conditions of this moment in history, the fact that these communities are continuously drifting away and like more exposed communities are growing at a lower rate, but at the same time have now higher fertility rates, that's only going to make these communities look even more different than the past, and than those not affected as much by the opioid epidemic. So I think like the overall realization of the effects is still yet to happen and to be understood. But how then does that affect like political leaning or political support for one party or another? I don't know if like we've yet to see the whole effect of this, but for sure this is something that is still affecting how like everyday life in these communities.
Right. Carolina, this has been a really great conversation. I really appreciate you taking the time to do it. I guess just to cap the conversation off on, obviously you spent a lot of time, you've done several sort of research papers within this area in particular. What's a piece of research or a study area, or potentially even a data set you would like to get hold of or look into that you would like to see conducted or explored in the future that could help build upon the findings of this paper, but maybe your research into the opioid epidemic more broadly?
So one thing that we tried to explore at some point, but because we're not experts in that area, we didn't go anywhere, but I would like to see some work on, is actually on like mapping or tracing how do the lobbying efforts from these companies actually played out. Because sometimes you would see in like news reports of like, oh, $2 billion were sent to the state race in Utah for by like this pharmaceutical company, or by the American Academy of Pain, or like this type of like nonprofits that are actually like completely funded by these firms. And in principle, all of those donations, like campaign donations, have to be disclosed somewhere. But we couldn't really ever add up everything that was disclosed to like some of the news pieces that were saying like this company gave all of this money for this race, this state Senate race to this politician. So I think like an understanding of like how they were actually using their money to affect the elections at the federal level, state level, judges, prosecute, like all of these like different races. I think that would be very insightful to really understand how all of this could happen for so long, and everyone just thought that this was normal and acceptable.
Yeah, no, I think that'd be super interesting. I think, to be honest with you, again, there's someone that lives in the UK and sort of outside of North America, but sort of interacts with it at various points. Just something that I think would be really good for my own knowledge is just understanding a little bit more about how lobbying works and sort of the politics and stuff. I mean, obviously, it's not like the UK and Europe are excluded from these things, but the sheer amount of volume of money that is thrown around through different lobbying institutions in America. I mean, you look at it from various groups and say something. I don't even need to sort of start reading them off. I think people are aware of them. It's just something that I'd like to understand a little bit more. I mean, a lot of them are even household names now, right? So, just I think from my own experience, just having a little bit more knowledge around those areas, and in particular, potentially some research into this area specifically would be, really, really insightful understanding, I hope.
And maybe connecting this with your previous point about like other health shocks. I mean, it's a completely different context, but I'm still surprised about the amount of marketing there is now around GLP-1 drugs. You see these everywhere in the US, like in sports events, in airports, like everywhere you go. I think every American sees advertising about like these drugs every day. And this is direct advertising to consumers. It's like, ask your doctor. And like, well, I mean, we don't have the knowledge to like be going around our lives demanding medication.
Yeah, this is something that I really had to sort of like understand when I've been talking to, again, friends and sort of counterparts in the States. This concept of asking your doctor to prescribe you a specific medicine is just very foreign and alien to me. You know, again, the idea that I would somehow be more informed than a doctor who has like studied it and the patients understand it, is just, again, a very foreign concept to me. And it's probably because I've grown up in an environment where the marketing of prescriptions and medications and stuff is just not as prevalent. And so I think I'm just a little bit naive to it, I think, in many regards. But yeah, I mean, particularly when we talked about some of the lobbying there, but I mean, something that links to that, and we kind of touched on a little bit earlier, is just some of these financial incentives and stuff. I mean, something I would like to, probably I just need to do a little bit more research on, is understanding how a lot of these financial incentives works, in particular as it pertains to doctors, or even dentists and other practitioners, right? In regards to what financial incentives are in place for them to promote certain things, and are there conflicts of interest with that and the care that they receive? I think as well. We've got, again, just to add on to your to your other point about some of the lobbying stuff. But Carolina, thank you very much. I really, really enjoyed this. It's been really great. Thank you very much for your time, and I really appreciate it. Thanks.
Thank you for the invitation.